here at the National Rural Health Conference, and I have with me today Joshua Marsden. Welcome.
Thank you.
And you've come from My Life Health Services.
That's correct,
right?
yes.
Cool. And you've got something pretty exciting, pretty new and innovative called the My Life app, isn't it?
Yeah, that's exactly right. So it's a program my partner Louie and I have been working on for quite some time for an area that is quite important to us, heart disease. So we grew up in rural Australia, and both of our grandparents died quite young from heart disease. So fast forward 14 years, that's what led us to founding My Life Health Services. It's a digital health company where we're basically working to reduce the number of New Zealanders and Australians dying from heart disease. So what's unique about our program is we allow patients to complete the program at their home in their time. So accessibility is the biggest hurdle for rural healthcare, and we're breaking down those barriers. And what we've done is we've created a digital behaviour change toolkit to basically trigger patients along the journey to keep the retention high and the engagement. So our key tools are the buddy system. So what we're doing is we're allowing every patient with heart disease to bring along a family member or friend to go through the entire program from start to finish. And this is really important because the family member is quite often the person that's most distressed when their partner or loved one has a heart attack. So if we can educate them, it goes a really long way. And then we've also gamified the entire process so that they're getting intrinsic rewards of joy and behaviour change and weight loss and so forth, and also the extrinsic rewards of trophies into their trophy cabinet, virtual high fives and that sort of thing.
Awesome. And so this is like a trans partnership, kind of like Australia and New Zealand, you've got this rolled out.
Exactly right. We've just come over to New Zealand because it's such a great opportunity to bring this program because you've got the same hurdles here in New Zealand as we do in Australia with a lot of isolated New Zealanders. So if we can come across the trans and support more people with this digital solution, that's a good thing.
So can you walk me through it? Like if I wanted to get this app, what do I need to do apart from having heart disease?
Yeah, exactly. So you don't need to have heart disease, but the funding model help. So essentially what will happen is your GP or your cardiologist will refer you into cardiac rehabilitation, our digital cardiac rehabilitation program. And what that happens is that triggers us to give the patient a welcome call, let them know about the program and how it works, and then their role, the patient's role, is to link up with a family member or friend to start the program. Once they've done that, they've got 10 weeks of behaviour change. So each week they'll focus on a different behaviour. So it might be physical health, mental health, nutrition, and we'll actually provide resources to support that behaviour change and a mini challenge. So an example might be week 2, you focus on improving your nutrition. So challenge might be the 2 and 5 fruit and vegetable challenge. So you need to increase your fruit and vegetable intake, and to do that, you need to take photos of all your healthy meals, and they're shared on the social platforms so other people with heart disease in the heart disease community can support you and congratulate you for making that behaviour change, and then you're rewarded for that by points on your leaderboard and then trophies into your cabinet as well. So it's all these little milestones from week 1 to week 10 that will help the patient stay in the program rather than dropping out after week 1 or 2 because it's too hard, they have to go to a physical location, they find the exercise boring. We're trying to give patients experience that they enjoy so they can carry them over long after the challenge is done. And that's why joining the family into the program is really important because it's a lifestyle change for the whole household rather than an isolated approach for one person.
Totally. And plus, if you've got another family member on there with you, there's no way you're going to veer off from the program.
Exactly. There's that little competitive nature. You know, we want to support those around us, but also beat those around us. So it's a two-way approach, I think.
Okay. So when did this first come out?
So we started working on the project in middle of 2017, so middle of last year, and we've gone through some accelerator programs, and we're just about to start the pilot in Australia, and we're actually looking for a pilot site or a couple of pilot sites in New Zealand as well before we commercialise.
Oh, fascinating. That sounds exciting. And so you go through your GP to sign up, and then does the GP look after that information, or what happens to that information?
Yep. So the information is stored again completely confidential or secured on the My Life platform. But the referring practitioner can basically go on at any point, check their patient's progress. They can interact with the patient themselves, or they can wait for the final report at the end of the program. And then when their client comes in for regular checkups, they can quickly go on and see, oh, I noticed you've done X, Y, and Z. That's really great. So they can use that as a a talking point.
Yeah, and I can imagine the data from this will be quite rich as well, you know, understanding behaviours and changes and what people do and at what times. And
Exactly right. So that's one of the benefits of the digital platform that we're building is we take so much data, and we've actually enlisted a PhD from UCLA University. He's a digital behaviour change expert and a predictive behaviour change expert. So he's going to be able to help us use that data to then predict people's health behaviours going forward. So we'll be able to basically use this model into things like diabetes, pulmonary, musculoskeletal injuries to help change all behaviours, not just heart disease.
Sounds fantastic. Great new innovative idea that's been coming out.
Yeah,
Look forward to seeing the results and hopefully see some change over the time.
Absolutely right. That's what we're looking for as well.
Awesome. Thanks so much.
Thank you.